from every other viral outbreak that we've seen that
Well,
wanes
it's new.
in the summer.
I don't know how it's going to
Yeah.
behave, but we expect it to behave like a normal viral
Okay.
infection.
All right, thank you.
Thank you, Commissioner Valashay. I have just a couple quick questions. What's the antiviral timeline, if any?
I'm sorry, say that again?
Antiviral the production or the discovery?
I
of-
can't comment on that. I have no idea what they're doing or how they're doing it. I don't have information on that. I'm sorry.
Okay. Who's the decision maker as to whether someone gets tested or not by the state?
The decision is made with our information, and we have a protocol to follow. We've taken out the criteria for travel.
Which enlarges
Largely, the person has to have some symptoms.
Okay.
And then we try to take the history in terms of who they've come in contact with. That's quite in depth. So we talk to the patient, and we also talk to the doctor that's actually treating the patient. That conversation takes place. If there's extraordinary circumstances that still needs to be tested, then we call our state epidemiology. We converse. Sometimes they say, yes, go ahead and test. We haven't had any problems with people with symptoms and medical information to test. If there isn't any connection or there isn't any criteria to test, then they call the CDC, and that conversation can be had with the CDC. Sometimes they say yes. If there's no real criteria, then they are not tested.
So is it the Florida Department of Health that ultimately makes at this time the decision to test at the state lab, or not, or is it at the CDC level?
With the state and the CDC.
Okay. Is any of that sort of the triaging of who gets tested and does not, is that a function of lack of test kits, or what's the reality about the supply?
We're following the FDA, the ones that created the tests, the guidelines that they have given us. We don't want, there's not unlimited number of tests, so we want to make sure that we are testing the right people. And a person who doesn't have any symptoms, we
Probably
don't feel
wouldn't
that
have
that's
been
appropriate
tested.
to test them based on the guidelines that was set up for the test. So we're following the guidelines that the test was designed for.
Okay. Do you feel that there are enough test kits accessible in the state of Florida?
We in Palm Beach County have had no problem. I can't speak for other counties, but we in Palm Beach County have had no problems with the test kits.
Okay.
And we're getting them, prior to having them in Miami, we were picking them up from the hospitals and sending them ourselves to the CDC. So we have plenty of staff that if anybody needs help with that, we can help them.
All right, very good. I don't see any other lights from my colleagues. We do have representatives from two other offices of government, both the county sheriff and members of the school board and the superintendent. Madam County Administrator, should we turn to Sheriff Bradshaw? You recognize, sir?
Thank you, and good morning. Is this on?
Yes, sir.
Okay.
Is there a button there?
It's hard to hear this way. Just a couple areas that I thought would be of interest for not only you to know, but the public to know of what the Sheriff's Office is doing. We've purchased 4,000 biological suits that will take care of the deputies on the road and the deputies in the jail and any civilians that may come in contact with the public. We have used for quite some time a product that not only will kill bacteria, but also the virus that we use to sanitize the jail that we've now made available to the people on the road. As far as the jail is concerned, we've had people make inquiries about people that come into our custody and then leave. How do we know they're not infected? We always have an infectious control doctor at the point of entry. All people that come into the jail are given a thorough examination, not only by the infectious control people, but also the RNs that are there before they're lodged in the jail. So anybody that we believe may have those symptoms would be immediately referred over to the health department for screening. On a regular basis, the jail is scrubbed all the time. Like Commissioner McKinley said, we've been through all kinds of viruses that may or may not have affected the jail. MRSA, we're very cognizant of that, so the jail is sterilized in all the areas that has any type of contact, and especially with the food vendors that come in. We have isolation protocols in place in case we do have to isolate somebody. We have an area and we have those protocols in place. As far as a quarantine, if in fact a quarantine We will be prepared to enforce that. We've been in contact with the state attorney's office to find out what the legal guidelines are. There's a state statute that addresses that, and we're fully prepared to enforce a quarantine if in fact it comes about, and take those people into custody if in fact they violate it. On the Homeland Security front, one of our concerns always is, and it's a heightened security risk now, is of course the boats that try to come ashore here, and we deal with that on a weekly basis. And we encounter a lot of different backgrounds are on these boats. It's not uncommon to get Chinese nationals on these boats. We've had those people on the boats, so our protocols have changed a little bit. We work very closely with the Coast Guard and ICE and the Border Patrol, but now we're going to make sure that we're protected a lot more for dealing with these people that are trying to come into our country on these boats to make sure that they're not going to get in here. We had a meeting with Regional Domestic Security last week where all 132 agencies were present. Bill Johnson was there for emergency management, just to make sure that everybody in South Florida from Martin County South has the proper protocols, has the proper equipment, is doing the right thing, and that our communication is in line where it should be. So if something's happening in Miami, something's happening in Broward, Bill Johnson's going to know, but law enforcement is going to have that type of information. And again, talking with Dr. Alonso this morning, one piece of the puzzle that we were missing is we didn't have information to know if somebody in a neighborhood was presumptive and being tested. We told them we didn't want to know the name, but we needed to know the address, because when fire rescue is responding to an address, or the deputies, that's good information to know that at a certain address somebody could have been infected, so we can take additional protective measures. That was resolved this morning, I think, in her phone call up to Tallahassee, so that's an important piece of the information. The Fusion Center is in constant contact with CDC and National Institute of Health daily. They have a phone call first thing in the morning and later in the afternoon to make sure that we're up to date on everything that's going on and if anything is going to affect South Florida. So the public needs to know we're prepared. We're ready to do whatever needs to be done. We're in constant contact with emergency management and Dr. Alonso's department, so we're good to go.
Very good, Sheriff. Thank you for the presentation. I don't see any questions from my colleagues. Dr. Alonso, I meant to ask initially, and I apologize for going back. Should we expect at some point to have a case or cases in Palm Beach County?
It's inevitable.
Okay. And so when that time comes, it's important that the public knows that it will probably happen at some point, and that's not a cause for panic at this time. Very good.
Correct.
All right, wonderful. We have representatives from our school board. We have our chairman, Frank Barbieri, and our superintendent, Dr. Fenoy. I'll turn it over to the school board. Superintendent Dr. Fenoy, I'll turn it over to the school board.
Well, good morning.
Sorry. Well, oh, Karen Brill is also in. Okay, school board member Karen Brill is here. Thank you for joining us. I didn't see you. I apologize. There you are. Very good. Dr. Fenoy, you're recognized.
Yes, sir. Good morning, Mayor Kerner, Vice Mayor Weinroth, Administrator Baker, and the Board of County Commissioners. On behalf of the school board, I appreciate the opportunity to collaborate with Dr. Alonso and the Florida Department of Health and with the Board of County Commissioners. Dr. Alonso graciously updated our school board last week. It's through collaboration and coordination with local, state, and federal officials that our schools are taking deliberate steps to disseminate information about coronavirus and its potential transmission within our school community. As Dr. Alonso stated, it is imperative that we as a county and state leaders remain calm but deliberate in our efforts to inform and protect our community. As an educator and as a father of 2 children in the school system, I know how important it is to maintain a sense of normalcy for all of our children. Principals at our 179 district-operated schools are going about their day with their normal lessons as much as possible. While there are no known cases of coronavirus in Palm Beach County, I would like to assure the board, as I have the students, staff, and parents, that the district is being proactive. There is a lot going on behind the scenes. The district continues to enhance deep sanitation methods, which I initiated late last month. In the audience is Mr. Paul Strauss, who's the head of our Environmental Services Department, staff of professionals trained in environmental project management and infectious disease response. Our schools are also staffed with highly qualified nurses who are truly our eyes and ears as we monitor infectious disease on our campuses. These healthcare professionals report illnesses and trends so that the district can respond in real time and when necessary involve the health department. Additionally, district administrators have a comprehensive infectious disease response plan in place to ensure that learning continues in the remote chance that our normal operations are disrupted by an outbreak. In an abundance of caution, I have suspended district-sponsored out-of-country field trips. I am also recommending that students and staff cancel any non-district-sponsored international field trips booked through a third-party vendor. In-country, district-sponsored field trips are still permitted, but we will cancel if the health and safety of our students become a concern. In my continuance who may be visiting high-risk countries over spring break, to be well aware of the CDC recommendations to self-quarantine for 14 days upon their return. I have directed district administrators to provide daily updates to parents and staff as the situation is evolving from day to day. The district has also launched a website available in English, Spanish, and Haitian Creole, dedicated to providing information and resources about coronavirus. The website is updated daily. In fact, this board meeting is streaming live and being recorded on our district website right now. For all those in attendance, please visit palmbeachschools.org/coronavirus for the latest updates. At this time, I turn it over to the chairman.
Chairman, you're recognized. Thank you, Dr. Fenoy, for those comments.
Good morning, Mayor Kerr. Son? No.
Yeah, make sure the button's pressed.
Good morning,
Okay.
Mayor Kerner, Vice Mayor Weinroth, Madam County Administrator Baker, and members of the Board of County Commissioners. I, too, would like to thank you for this invitation to collaborate and update you on the measures in motion to maintain the health and safety of our school district students and staff. We believe that it was important that both the superintendent and I be here today to ensure that the parents of our almost 200,000 students understand that both the school board and the administration take their concerns seriously. Like the superintendent, as chairman of the school board of Palm Beach County, there is no greater responsibility than representing the students and staff of the school district and ensuring that our campuses are safe and our children are as secure as possible from all threats. Our school board is united in its commitment to the welfare of our students and staff and will remain vigilant on our leadership through this current health concern and beyond. Despite being the 10th largest school district in the United States, our district is tight-knit. Our parents reach out to me and other board members directly with questions and concerns. I and my colleagues feel a personal responsibility to every child, parent, and staff member in this district. As a district, we are indebted to you, our commissioners, our health department, and other Palm Beach County leaders who are currently collaborating with us in an effort to prepare and persevere should coronavirus impact our community.